Welcome.
It's lovely to be here.
Thank you for coming on to the Francesca Crossfield podcast.
It is so lovely, and it just reminds me of our journey together being here.
Oh,
Sat on this couch. I love it.
Oh, it's lovely to have you back this morning. Even though you turned up early and I was like, what time is it? I was totally not here for a moment this morning because
That's so fine.
It is a 7/7 portal today.
I don't know what that means, so you can enlighten me.
Okay, so it's linked to astrology and to the sun and the planet Sirius. And the 7/7 portal is very much about consciousness, shining bright, which you get to do today by sharing your story and your wisdom and your love. And it's just a really powerful portal. There's several different ones, and you'll hear people throwing things around like Mercury retrograde and full moon, new moon, all these different. But portals can be quite intense. And this morning, I definitely felt like I was in a consciousness download when I was upstairs doing my own cards and getting ready for this morning. So then when the door went, I was like, I've totally lost track of time. I was definitely in a portal.
Wow, it's not like me to be early, is it? Well, you know me well enough to
I
know
was a bit
that.
shocked.
Yeah.
Maybe you were in the portal and it shot you here.
Maybe. Bless you.
So before we get into you shining your light today, I would just love you to share with everyone who you are and what your profession is.
Yeah.
And how we met.
Yeah. So I'm Hannah. And I am an independent midwife. I have been a midwife for 15 years now. That hasn't all been in independent midwifery. I've been in that space for about 3 years. Before that, I worked in the NHS. I also went and worked in New Zealand. And I worked as a lecturer at a university. So for a midwife, my career has been completely within midwifery, but it's been quite varied within that. And we met when you were pregnant with your 5th beautiful baby girl. And that's where our journey began together.
It did.
Yeah.
It did. And what a journey that was.
Yeah.
I mean, from start to finish, working with you was beautiful.
Thank you. Likewise.
And so heartfelt. Don't look at me like that. I think I'm going to start crying.
That's all right.
From the moment we had that chat and FaceTime, I think I just knew that we were to work together. Yeah. You've got such a beautiful, warming, gentle, loving energy as a midwife. And having 5 children, I've had quite a few midwives.
You've been round the block, Fran.
Now.
You've tested us all out. Bless you.
So, yes, but I knew from the start with Freya it was to be independent. Yeah. After experiences I'd personally had. With NHS births. Yeah. You know, I've had 3 NHS births in hospital, extremely medicalised. In the hospital, 2 of those were instrumental, and one extremely quite traumatic, you know, without going into too much detail. So you weren't my first home birth.
No.
You were my second.
Yeah.
But we'd had such an age gap of 10 years. Yeah. It was like starting all over again, which was interesting. Yeah. And so was the length of the labour.
Yeah, I think that took you by surprise, didn't it? Yeah.
It did. But my question to you is, what was it like birthing with us in the garden? And what made you choose to be a midwife?
Okay, so I'll answer what brought me to midwifery first, I think, and then come on to your birth, which was beautiful, by the way. So in terms of midwifery, I always knew that I wanted to be in a caring profession. Like being little, it was being a vet and working with animals. But from knowing what midwifery was, that was an option, I knew that's where I wanted to go. And I did have a bit of a dabble towards, well, should I go down the doctor route? And that's actually what I first applied for when I was doing my university applications. And I didn't get in, which made me take a minute, take stock and go, what is it that I actually wanted? And then I realised, in terms of being a doctor, as much as I think it's fair to say within society that's put on a pedestal as, you know, a really good profession that you should aim for, I realised that within the maternity space, because that was still where I wanted to head towards, even if I was a doctor, I would just be called in when there was a problem. I wouldn't get to journey with women. And that's what's really important to me. You may or may not know, but midwife means with woman. And that epitomises, for me, what I do. It is all about walking alongside a woman, being part of their journey, but supporting them. Like, women should be the focus of everything that we do, and what they're wanting, rather than tick box set of rules, but I'm sure we'll come on to that. And in terms of your birth, I remember when you said that you wanted to have a tent birth, is how I refer to it, and just being really excited, because that is so you and Martin, and that's part of what I love about birth. Like, yes, we have different we kind of classify births in, like, is it vaginal birth, is it a cesarean birth, but I think birth should fundamentally reflect who you are and what is important to you. Like, it should be like, if somebody walked in, which that nobody should ever do, in your labour, they should be able to, like, look around at the space, and even if they don't know, you get a bit of a sense of who you are. And that was very much true for you, and I love that. I also remember us having an appointment with one of your consultants, and you mentioned it, and I was like, oh no, Fran's mentioned it.
No filter, Francesca. We know.
And I mean, to be fair to that consultant, she did throw a paddy, which is kind of what I was expecting. But
oh, no. Hang on, sorry, I'm listening. That consultant, I liked her.
Yeah.
Rocky is trying to do a backward sneeze. So if you've got lacerapsos, you might know that they sometimes have this, like, backward sneeze that sounds like a snorting pig.
Oh.
And it's quite distressing to listen to, but if you just gently squeeze his nose, he kind of, like, swallows the sneeze backwards and then he's fine.
Oh, nice.
He was born with quite a few things, bless his heart. So yeah, we were back to the consultant.
Yes, so the consultant, she actually handled it really well, but I just remember being like, we have thought about it and we've got heaters in there. But yeah, I think with anything, you know, if you have an idea in your mind about what you want for your birth, I think you should be able to voice that. And then it's then my job to think, okay, is there anything that we need to think about? But yeah, it was beautiful.
It was. And it was, as you say, it did reflect me and Martin. Yeah. It was quite free, but still, I feel a sense of guarded, protected. It was wild, because we were in the wild, you know, outside. A little bit unpredictable. Yeah. And it was very family based, you know. We came together as a whole family. I had the whole tribe. I had all my ducks home, you know, as we said. I couldn't birth until even my eldest son had come back, who's 20, believe it or not now. And sometimes we just need all our ducklings back, don't we? So we can just nest and go within. And she was a land baby. I thought she was going to be in the birth pool like Tobias.
Yeah.
And I knew deep down, I should have just voiced it earlier on, she's going to be a land baby, and she was born, you know, on the 10th floor. That rug had to go to the skip.
It's not the first time I've been at a birth and been told the rug has to be chucked out.
But it was fantastic in every way. And the way you dug deep with me, persevered when I ran out of energy, all that honey and those blueberries.
Yeah.
And the stair lunges.
Yeah.
The chair lunges.
Yeah.
Because if I'm totally honest, I feel like if I'd have been in hospital, it would have been a failure to progress in a C-section.
Yeah.
Or that's what they would have tried.
Yeah.
And if I'd have not been so well informed, educated, confident in my own belief, and my body and what I was capable of birthing my baby, that I would have gone along with that in hospital, and it could have been a very different story for me and Freya.
Yeah, I would agree with that. But I also strongly believe that mothers know what's going on inside of them. And if you had felt that there was something wrong, you would have voiced that. I think, you know, it took a bit longer than anticipated, but at no point did you say, this is like, there's something wrong, that my baby's not going to come out. And I think our job as midwives is to listen to you, and that's part of the relationship that we build up beforehand. Like, we know each other really well. And so when you're in that birth space, which is fairly vulnerable for most women.
Extremely.
Yeah.
I felt vulnerable, and it was my 5th baby.
Yeah.
And everybody expects you to know what you're doing.
Yeah.
The baby's going to fly out.
Yeah.
You know, because it's number 5.
Yeah.
Absolutely not.
Yeah.
She was my longest, I'm going to say, natural birth, because there was no intervention.
Yeah.
And I was, you know, shocked that it was the length that the labour was, but I had there was no concern or fear there that it was taking a longer time. Yeah. It was just I never really contemplated it could be a longer birth. But I just had this feeling like she was still okay. She was just taking her time, and we had that one moment where you listen to her heartbeat, and because we had amazing continuity, because I trusted you, because you knew my body so well, because you'd done every single appointment, maybe bar like 2. Yeah. And you'd listened to her heartbeat from the very beginning. Yeah. You knew Freya's normal and ratio. You knew my normal and ratio. Yeah. And even I knew it. So I didn't even realise I knew it. It was that imprinted that when you said her rate had just gone up that little bit, I knew she's a bit unhappy. But the next time you listened, when you asked, Fran, is it okay? I'm just going to listen in. And I love that you ask every time before you touch me. And when it had gone back to her ratio for her, I knew she was fine. Yeah. But I knew intrinsically that if that was high again, that I was going to have to start to come to terms with the process that it might be a transfer into hospital. Yeah. But it gave me that self-awareness and time to process, which I think a lot of women don't get in hospital.
Yeah, absolutely.
Which leads on to my next question.
Yeah.
What is the difference, for those that don't know, between NHS midwifery care and going to hospital and independent?
Yeah. I would say it's a vast difference, to be honest. And the way I see it, it's not that one is good and one is bad. They're just very different. So within the NHS, it's very structured. You must be seen at X, Y, and Z points. It's different, the guidance for a first-time mum as opposed to a second-time mum, which I personally don't agree with. I think that can be really surprising for second-time mums, that they see their midwife a lot less. And it is different depending on whereabouts you are in the country and what your trust is doing, because some trusts will go with that and some will keep it the same for first-time mums and subsequent mums. Quite often you see multiple different midwives throughout your pregnancy, and I do think that is problematic because it means that every time you see somebody new, you've got to repeat your story. And let's be honest, within the NHS, they don't have a lot of time. They are very overstretched. So when I was a community midwife within the NHS, I had a caseload of 120 odd women at one time, and there's just no way with that many women on your caseload that you can have the depth of relationship that we develop together, the depth of understanding, and subsequently, because you've got that many women, the appointments are much shorter.
Is it fair to say you can't be as present?
I would say so. I think they are just so stretched that I do think they're doing the best that they can. But again, depending on where you are, some trust you have a 10-minute appointment. That's what I was trained on. 10-minute appointments.
10 minutes?
Yeah.
How long were our appointments?
I would say on average 3 hours. And, like that's part of being an independent midwife. You tailor your care for the person that you're with and what works for them. So I do have clients where my shortest appointments are an hour. And to me that's short, but that fits that client. And other clients where actually, no, we need a bit more time to talk and be, and again, not right or wrong, but I have that flexibility to be able to go, okay, we need more time, and that's absolutely fine. And I love that. You cannot possibly have a 3-hour appointment in the NHS.
It's not possible. I mean, you need half an hour to meet all of our children as they come through the door. Elliot had come from school, Tobias had come from school, Faith had come in from college.
And that's the other thing that I love about what I do, because it's all in your home environment.
The pets, the pets greeted you with so much love today.
Absolutely.
And you are part of the family now. You get invited to our celebrations. Freya was so relaxed with you this morning.
Yeah.
And you're in our hearts forever after that journey.
And for me, that's such a privilege, that I get to journey in that way. I love it so much. I now couldn't do midwifery any other way. And it also means that, when it comes to birth, like we've said before, I know you so well. I am going to be the midwife present at your birth. Within the NHS, it's highly unlikely you are going to know the midwife present at your birth. And this caused a lot of controversy, actually, when I was within the NHS, because there was a period of time, not so much anymore, but there was a period of time when the NHS was trying to do continuity of care, because there is so much research out there about how that improves safety for mums and babies. How can it not?
Absolutely.
And so they were trying to create this, and there were a lot of midwives that were really offended by that statement of, I think they were taking it as, you're saying that you're a better midwife because you know the family, and that's absolutely not the case. There are some fabulous midwives that work on labour ward, and it is a skill to meet somebody that you've never met before who's in labour. Do
a dynamic risk assessment.
Yeah, absolutely, and create that rapport really quickly. That is a skill.
Yes, it is.
But there is no way you can possibly have the depth of understanding of somebody when you've just met them.
I completely agree. And I think there's an element of natural ego that comes into that. Are you saying I'm not as good?
Yeah.
On that, because continuity changed my whole perception of my capabilities, of my body, and my connection with my baby when I was pregnant, and my birth journey.
Yeah.
And that's speaking from a lot of experience, having 5 and having those 3 births in hospital.
Yeah.
I've experienced what you're saying, the different midwives coming in that you've never met. I was in labour for so long with the first 3. My first 3 were inductions. I've had 2 or 3 midwives changing hands and shifts and having to tell that story all over again. Yeah. Which gets harder and harder the longer your labour's going on, and the more exhausted you are and the more in pain you are. Yeah.
And you don't want to do that when you're in labour. You just don't want to, and I believe you shouldn't have to, you know. Again, I think that's one of the beautiful things. You know, like I remember coming when you first said that your waters are gone and you were in labour, but it meant that from the beginning of the labour until Freya was born, it was me and the other midwife that was with me, Sally.
Oh, what a woman.
Yeah, she's fab. I love her. And that's one of the other things that I was thinking about, you know, when thinking about having this chat with you. Even the second midwife, we made sure that you'd met Sally beforehand. And I'm really conscious when I pick a second midwife of lots of different things, like what's their birth ethos like, what is their personality like, and how's that going to work for the client that I'm working with, because we're all different, aren't we? And we all need different things. And I am very fortunate that I've got lots of amazing colleagues to choose from, but I will pick certain midwives to come and be the second at the birth based on those things. You just can't do that in the NHS. In the NHS, it is whoever you get at the time, whoever's on shift, that is who you have. And I always describe it as kind of rolling the dice. You may roll, sorry to go super geeky, but you may roll like a D20, which is, if you don't know, is like the best you can roll. And you, so like perfectly aligned, you know, see things the same way, instantly click. Of course that can happen. But there are also times where things are completely misaligned. You see birth in a completely different way. You as a woman come into your birth with, these are my hopes and dreams for my birth, and that doesn't quite fit with how that midwife practices. And you can't predict that. It is a dice roll.
Well, it's safe to say you picked well with Sally for my second midwife. Hopefully we can get Sally on to do a podcast one day, because you picked well. She had very similar, you know, beliefs. She was very family orientated.
She is.
She was so knowledgeable in tongue tie. And as we know, I have now had 5 tongue tie babies. But at the time we didn't know if Freya was going to be tongue tie. But there was a strong chance. And so that was amazing that she had that tongue tie experience for us post-birth, if she did have one, and for our breastfeeding journey. She was able to offer me acupuncture as part of the package. And that was amazing, because the morning sickness, as you know, was debilitating for me with Freya. Like, I was a broken human. And she just, again, fit right into our family dynamics. And she was just so professional, and I feel very honoured to have her in our life as well. And it was so beautiful to have you work together, that there was a backup, that if, you know, you weren't available for any reason on that day, and the regularity and the quickness and the responsiveness that you both had was also invaluable. I cannot say how priceless it is, and I can't emphasise enough, to be able to text your midwife any time of day with any question you have when you're vulnerable, when your anxiety's bad, when somebody said something to you that's worried you when you're pregnant, when you've got a new symptom, and when you just don't feel right, when you've seen a poster with some information on and you're like, oh, I want to question that. The amount of support, even via text and phone, in comparison to NHS care, and this podcast is not about slating the NHS, it's about bringing to light the importance of continuity, I think, and also to educate on independent and home birth and women's choices, because this is not also just about promoting home birth. You can have an independent midwife and have a hospital birth, can't you?
Yeah, you absolutely can. Many women do choose that, because when we look at hospitals, they are systems, and when you are working within the hospital, you are a part of that system. And it can be quite hard sometimes.
I'm going to get cramp in the middle of this podcast.
Do you need me to massage?
No, darling, it's fine.
So yeah, when you are a part of the system, it can be quite difficult to see that. Like, there's this, I'm not going to get the quote right, so I'm not going to try. But, you know, like when you're a part of something, you can't really see that maybe it might be done differently elsewhere. In fact, I've had it said to me when I was working in a hospital, I was challenging a certain practice, and the response I got, well, that's just how we do it here, which to me is never an acceptable answer.
That is below my standard of response for...
Well, I just think, like, that just says to me, you don't know why you're doing the thing that you're doing, but you're going to do it anyway.
Which is quite unsafe, really,
It's
as well.
It's bizarre. It's bizarre. Like, you should be able, like, as midwives, we are regulated, and we should be able to, like, reason why we do everything. And sometimes guidelines within the hospital are for the sake of the hospital and their organisation, and don't necessarily fit every woman that comes through. Kind of like what you were saying about it had you given birth in the hospital with Freya and things had been
as they had been, a bit longer than expected.
Then it's more likely that they would have started to intervene. Whereas, because we know you, we felt that all the other parameters were completely safe, we can then tailor it to what we felt was right for you. And I think that tailoring doesn't happen so much within the NHS.
Absolutely not. And I think we knew going to hospital for me was a last resort.
Yes.
Because of the PTSD and things that I'd experienced from my third birth, it was the third birth with Elliot, who is 16 next week. Can you believe it?
No.
And that's why I can probably talk about that trauma now with such calmness, because there was a time after it happened for probably about 5-6 years, I couldn't talk about what happened to me in hospital without breaking down into tears. It caused severe trauma and years of unravelling. And I'm still not the best with blood after that experience. But I was failed so many times with that third birth. I mean, there'd been a lot wrong with the first and the second birth. But that third birth in particular, that induction, everything that happened, even though he was born vaginally, quite safely. There was no instrumental, there'd be no forceps like the first, there'd be no ventouse like the second. But I wasn't listened to.
Yes. So fundamental.
And I knew my body. I'd had 2 babies. Well, I knew my body relatively well. I would say I know it a lot better now. But I wasn't listened to. Even when it came to, I hate the word pushing him out. He should have been breathed out rather than pushed. But I remember saying to the midwife, I need to push. No, you don't. You're only 7 centimetres. And I actually said, I remember on the gas and air with Elliot saying, I need to fucking push.
Yeah.
So I was hanging over the bed, because that's like my position, isn't
Yeah.
it? You know, on the all fours, a bit raised up. And I turned around and she went, oh, his head's there, push. Well, I've just told you that I can feel the sensation that I need to push, and you've told me that I don't.
Mm-hmm.
Don't tell me what to do with my body when we tune into our
100%.
instinct.
Yeah.
And he was born relatively, you know, healthy. And again, I just knew something was wrong. It was the 3rd stage. It was the placenta delivery, you know. And my cord had been pulled on. It's not the best. There was a student midwife, which I'm always for. I'm always for wanting to teach and help. I've been a student myself many times for things. It's important for them to observe, and you know, I learn kinesthetically, so I've always usually let them come into the rooms in hospital. It's not great having strangers walking in all the time.
Yeah.
Not many even ask your name.
That's so bad.
And yeah, they said the placenta wasn't healthy, it wasn't great, there was something wrong, but they thought they had it all, And because it was my 3rd child, again, they thought I knew what I was doing. They put me in a side room, oh, she's breastfeeding, she knows what she's doing. I'd never breastfed before. Elliot was the first one I breastfed, and I just didn't have a clue. Every time you have a baby, it definitely puts you back to being a mother again for the first time. Yeah. You are vulnerable all over again. Yeah. Anything you might have known previously as a mother kind of like just flies out the window, because we know the brain shifts, doesn't it? And I just knew something was wrong. I remember visitors coming after he'd been born in the morning at 10:15, and by tea time, people were like, you're grey and ashen, Fran, you don't look well. And I was losing so much blood and clots, like big clots, and I've not lost blood like that with the others. Yeah. And I kept saying to my husband at the time, there's something wrong. Yeah. It was his first baby. I don't think he really knew what was going on himself. And it was the best part of another 6 hours before they started taking me seriously. So I'd birthed 12 hours ago. And I kept buzzing that buzzer in hospital and saying, there's something wrong, you need to change my sheets again. I'm losing too much blood. Yeah. And Elliot, bless him, he was just cluster feeding for hours and then sleep. He was so great. It's like he knew. He just fed and slept, and it was like he just knew that he needed to, I don't know, just be very quiet. He was really quiet. I remember, even though he was responsive to me, he was so quiet. And it got to about midnight, and they did actually say, oh yes, we're going to take this a bit more seriously now. You are losing quite a bit of blood. I thought, I've been losing this for hours. Like, there's loads. I'm only little, and I was a lot littler back then when I was 21. And I remember them taking me to this room, and 2 men came with forceps. And I write about it on my blog. The only way I can describe it is being butchered. Yeah. And fiddled around with forceps. When you've just given birth. Yeah. And they offered me paracetamol. I did actually refuse. And I just turned my head to the side. And there was this disassociation that took over me, that this was going on, because I was like, where's somebody to hold my hand? Yeah. Where's there a nurse, a chaperone? Because there's 2 men in here. I've still got no answers as to why this is happening. Yeah. Like, where's my baby? Yeah. So traumatic. And it went on for a long time, probably till about 2 a.m, until they actually said, we think you've got some retained placenta. Which it was the first time I'd had that, you know. And they decided to give me a scan, and it was the scan that then showed, and they gave me some pain relief then, I think diamorphine, and I was off my noodle. Yeah. I am very sensitive. And I can still to this day hear the bleeping of the machines. And the being unaware of what was happening to my body. But by this point at 2 a.m, I was feeling incredibly ill, and I was still losing a lot of blood and clots. And I remember them saying to me at about 2 a.m, any more blood, we go to theatre. That was at 2. By this point, my husband at the time has still not answered his phone. I think they'd phoned him about 80 times the ward. And nobody in my phone book could come that I had reached out to support me. And Elliot was being looked after by the nurses, you know. Yeah. They were lovely on reception. I can remember them vaguely. But it was really lonely. Yeah. And they then came to me at about 3 o'clock and said, we're going to give you an injection to make your stomach contract. And I'm guessing, you know, get this piece of retained placenta out. But by this point, I was totally gone. It was several litres I'd lost by this point, and it got to 6 a.m. So much more blood before they took me to theatre. Now, I believed, Hannah, that I was dead. Yeah. I can just remember this beautiful woman who had freckles all over her hands and face. I can't remember her name, and I wish I could, because I'd love to thank her. And they took me to theatre, and I remember sobbing on her and saying, please don't separate my babies. Because Elliot had a different father to Faith and Jake. And I kept saying, please don't give him formula. It's my first time breastfeeding. Go to a breast milk donor bank. Yeah. Because I'd been going to a breastfeeding group to learn some information in pregnancy, and it was something I really wanted to try. And I was so frightened that they were going to be all separated, my babies, because Faith and Jake were only, 3 and 4 then. Yeah. And when they put me to sleep, I was all alone. And the trauma, I never thought I was waking up.
Yeah, that's awful, Fran.
And when I did wake up, I'd had several blood transfusions. The ex-husband was sat next to me. I was like, don't talk to me. You left me to die. That caused a lot of problems. Yeah. I was so ill, I had to take a year out of university for PTSD, for postnatal depression. And that's where breastfeeding saved my life. He got his tongue tie snipped. Elliot gave me a reason to stay alive because he needed me to feed him. I ended up getting the breastfeeding tattoo and everything. And it led to peer support, all sorts. It was fantastic. So something beautiful was birthed out of that trauma. But I can still smell the iodine. I can still hear the bleeping. Yeah. I can still feel the coldness of the forceps. And it took my first home birth midwife to come to my house and debrief me on what the hell happened to me that day with my NHS notes that we got, and for me to learn about what happened. Yeah. And that was 3-4 years later when I was pregnant with Tobias.
Which is really common, actually, in terms of birth trauma. A lot of women put it in a box as a coping strategy and don't look at it again until they're pregnant again, and the lid won't stay on the box anymore.
No, because we're pregnant and we're vulnerable and emotions are everywhere.
Absolutely.
And I would urge anybody who watches this and is touched by it or has experienced birth trauma to reach out.
Yeah, so important.
And that is something you offer as well, isn't it?
Yeah, I do birth trauma counselling. For me, that is really important because a lot of my clients that I look after have had a traumatic experience. I want to be able to sit here and say, that's awful, Fran. I've never heard anything like it. But unfortunately, I hear traumatic stories a lot, and trauma is different for different people. Something that I'm really passionate about is, if it was traumatic to you, that matters. Clearly what you're describing is very traumatic. There is no other way of describing that. Nobody could possibly listen to that story and not be touched and feel the pain in that story. A lot of women are quite often, and I don't know whether this is something that you experience, Fran, but are told, oh, but you're alive and your baby's alive, so that's fine.
That's what I call that story alive on my blog. Yeah. And do you know what? My story, no matter how much it means to me and what I experienced, what I went through, it's trauma in my individual right.
Yeah.
But I read and hear and see so much more trauma every day for women and babies and birth, and for fathers that are watching and observing the person that they love go through this. Absolutely. And their child. And I think it's fair to say that trauma is not rare anymore.
No, actually, within research, a third of women experience birth trauma, which I think is terrible. Like, birth can be so beautiful and amazing and really empowering. Mm-hmm. You know, I think birth is really intense. And I think it brings you to the edge of yourself, and you quite often are faced with a, can I do this? But you get through it, and a positive birth leaves you, I think, in awe of yourself and what you've been able to do. But so many women are robbed of that.
Absolutely, robbed of it. And it's so sad that women can't wait to tell you their birth trauma.
Yes.
When they're, when you're pregnant, other women can't wait to tell you their trauma, which is really not helpful when you're pregnant, especially. Absolutely. But also, then if you've had a positive birth story, because I've managed to transform it with the help of independent midwives, and have 2 successful, beautiful births that I'm so grateful that have made me, after all of that fear, after the 3rd, when I was told you can't birth at home, it's unsafe, you're high risk. Well, I did my research into everything. I became so informed, so supported with independent midwifery, that actually I had the least high risk births and lost the least amount of blood and had the bestest experience, and reignited my belief in myself and my body with the 4th and the 5th. Yeah. So it goes to show that you can transform it from a traumatic birth.
Absolutely. Yeah. And I think women are labelled a lot at the moment as you're high risk or low risk, although very few women get that label anymore.
Well, I think it's about time I ask you, when you've just said that risk, that alarm just started going off. Risk. Words are so powerful.
Yeah, so true.
How do you feel as a midwife about the latest maternity reports that have just come out, which are so prevalent right now?
Yeah, they
across
are.
the country.
Yeah.
Even across the world, because people are talking about it in the UK.
Yeah, absolutely. I mean, they are extensive. The Nottingham report, the Ockenden report, is over 400 pages. The Baroness Amos report is 170. I haven't read all of them, full disclosure, but I have read bits of them. It's really interesting because it's obviously focusing on hospitals and how they deliver their care. So what we're describing here in terms of risk and being labelled and being told you can't do something, it's not really what these reports are about. These reports are more about what you described with your 3rd birth. I know something is wrong. I'm telling you something is wrong. You're not listening to me. Because that is consistently highlighted in reports time and time over. So there have been multiple reports now within maternity services. It's been going on for a decade. All of them highlight mums, families feeling like they're not being listened to. And that is just the the bog standard basic of care, isn't it? You know, listening to people. I teach hypnobirthing, and I know it's something that you're really passionate about too. And one of the cornerstones of that is you are the expert of you.
Mm-hmm.
You know your body, you know what's normal for your body, and if somebody is saying something is wrong, we have to listen to that, because we you know you.
Absolutely.
What I do think is coming within these reports, there is a big push nationally to become more medicalised, to become more intervention heavy, and that is some of the recommendations within the report. And you know, there is a time and a place for interventions, absolutely,
100%. Sometimes a C-section is required,
absolutely, and it's
to
a
save a
life-saving,
life.
absolutely, it's a life-saving procedure, not at the figures that they are currently within the UK.
In my local area, I think it's over 50%.
Yeah.
What?
Yeah, because really, what is that saying about women? That's saying that 50% of women cannot give birth, and that's rubbish. Again, with induction rates, nationally they're over 50%, and creeping up and up. I firmly believe that's not right. 50% of women don't need to have their birth started for them.
No. And there's that aspect of, look, if a woman chooses to have an elective C-section, and that's
Absolutely.
her birthright choice,
100%.
there's a difference.
There is.
Between, we need to book you in for a C-section. That's already implanting that seed.
Yeah.
That's already putting a restriction on the natural birth starting, because words are so powerful.
Yeah.
Pardon me. And there is a real discernment around women losing their faith in themselves and learning about our biology and babies' biology. There is so much I wish was taught more in mainstream schools, especially if you choose to send your children to school rather than homeschool. Because it took me to have an independent midwife to learn so much about birth and my body.
Yeah. Yeah.
And it also took me breastfeeding peer support courses and facilitator courses for me to learn so much about feeding babies, which, even though it can come very naturally, it's in our, ancestral DNA to breastfeed, because we have breasts for that primal reason.
Yeah, of course.
But I didn't have a clue what I was doing. It's still one of the hardest things I've ever had to learn and navigate. Yeah. And it's a new journey with every baby. No, breastfeeding one baby there might be similarities to the others, but they're all so different. Yeah. And even down to going into labour, I wish I'd known little things. Like the due date. Yeah. I mean, come on. The first day of your last period. Well, the first day of my last period, I was actually menstruating. And then you've got to work out how long you're menstruating for. Yeah. And then you've got to ovulate and conceive. So realistically, that might take 2 weeks to finish menstruation, come into ovulation, and conceive. Yeah. So really, shouldn't we be adding that 2 weeks on, essentially? So I would say going to near more 42 weeks is actually way more accurate.
Well, it's very individual. What that's based on is a study of 200 women.
200, that's it?
Yeah.
So the due date is based on a study of 200 women?
Yeah.
And everybody's so fixated on that date?
And it was in Belgium, and it's 150 odd years ago. So it's really old, but also really would you call it, saying ethnocentric? It's one type of woman that it was studied on. Now, for nowadays standards for research, there's no way that would pass. but it's what we use now. And for me and my body, having now had 2 babies, I know I go to 42 weeks.
Mm-hmm.
That is my body's natural gestation period.
Mm-hmm.
And it's interesting when you look at different cultures across the world, their concept of term is different depending on where you go. So we say 40 weeks in the UK. In France, it's 41 weeks.
Mm-hmm.
In somewhere like Kenya, 43 weeks is normal.
Mm-hmm.
So just the fact that there is that variation tells us, doesn't it, that this hard and fast rule, but so much of care is dictated around that.
The due date, yeah. Wow, you learn something new every day.
Yeah.
And I remember learning once, please correct me if I'm wrong. Again, this is going back 11 years ago, I learned this, that when your baby is ready to be born, they secrete fluid from their lungs into the amniotic sac. And that triggers oxytocin, which we know plays a part in making the baby. Love hormone.
Absolutely.
And then moves on to the birth hormone. And then it's part of the breastfeeding hormone, you know. And once that fluid is secreted into the amniotic sac, the body goes into labour. You know your baby is ready to breathe air because it's in water. And I was like, wow, the baby decides when it's ready to be earthside. The baby knows, trust you and your body and your baby. I did not know that till I had Tobias. Baby number 4. How can it have taken me that long to learn that piece of information?
Because nobody told you. You can't know what you don't know, you know? lot of you knows.
But I was like, women need to know this because that would take a lot of pressure off. The baby's not here yet. The baby's not here. The baby's not ready. The baby will tell me when it's ready. And knowledge is key and wisdom. As we know.
True.
I mean, retaining it sometimes after 5 children is difficult because they say we lose loads of brain cells in my memory. My cognitive processing. Add a sprinkle of dyslexia and ADHD and that sounds so unpredictable.
Bless you.
No, some of that knowledge is really ingrained and embedded in there because I'm passionate about it. And mothering is such a huge part of my life. It's my massive journey to, you know, be the mother I never had, you know, for my children. So, back to this report.
We do this all the time, don't we? We go off
We
on
digress.
tangents.
It's fine. It's fine. We can bring it back.
So, within the report, I mean, there is so much. I couldn't possibly unpack it all.
We need to do parts of a podcast, won't we? Part 1, part 2, part 3.
Absolutely. One of the things that for me has really jumped out, and because it's something that I am super passionate about, we've already touched on it, is the continuity of care. And the reason that's really jumped out at me is Donna Ockenden, who has written the report for Nottingham. She made a statement in her report that she did in 2022, which was Shrewsbury Trust. She said that going back to the NHS trying to create these continuity models, she said that they had to be paused. That if you had to ensure that you had safe staffing before you proceeded with trying to create these continuity care models, which was fascinating. Because on the surface of it, it sounds really sensible. You're talking about safe staffing. Of course, you need to have safe staffing. However, at the time of the investigation, Shrewsbury didn't have a continuity of care team. So she made a really big statement, I would say, not based on the actual investigation that she was doing. But like I said, there's been a lot of controversy within maternity about whether it should be being done or not. And her writing that in the report brought a halt to the vast majority of continuity teams within the UK. But within this latest report that's just been released in the last couple of weeks, she mentions continuity of care over and over again. She doesn't say anything about reinstating continuity of care teams, but she does highlight the importance of continuity in every stage of the maternity journey. And again, as I've said, there is so much research to highlight how important that is, in terms of safety and providing the safest care for mums and babies. There is minimal recommendations about how to go about introducing that continuity, but to me that is quite the 180 that she has done there. So yeah,
continuity changes everything.
it does. It's massive. And obviously, as with every other report that has gone before into maternity, the first recommendation is listen to women and their families.
And women are saying we're not being listened to.
Absolutely.
They're not being heard.
Yeah.
And that's what's really vital, even if your birth doesn't go how you envisioned.
Yeah.
Which can happen a
Yeah.
lot. If you are listened to, if you are heard, and you have somebody to even speak your wishes for you.
Yeah.
Sometimes a doula does that.
Yeah, it's true.
I was going to speak to you about that, 'cause something that I feel will come into the future will be doulaing.
Yeah.
For myself. But the listening and the being heard and advocated for is so empowering.
Yeah.
It makes you feel so supported. It builds that trust. And that's what continuity is as well. It's about trusting that individual, trusting that practice. And it's funny how it's called the NHS trust.
Yeah. Yeah.
They want us to trust them. Well, listen to us then.
Yes.
Hear me.
Yeah. I find it so sad that time and again, that is one of the biggest things that comes out of these reports. Listen to women, listen to women, listen to women. And it's clearly it's not happening because it keeps being repeated again and again and again. And it shouldn't even need to be said. Of course you need to listen to women.
Hold that thought.
Yeah.
And we're back.
Yeah.
My next question is the stats in this report, or in both reports. What is it that stands out for you the most, apart from the continuity?
Yeah. So, I think you could probably ask 10 different midwives and they'll give you different answers. The things that stood out to me most, particularly in the Ockenden report, was in her letter to the Secretary of Health. And it highlighted that 2,500 families came forward to share their stories, which is just a lot. That is a vast number of families that feel and clearly did not have the care and support and clinical expertise that they should have had. That's a lot of people. And then the other one that stood out for me is the litigation costs within maternity are huge right now. So it is 2.5 billion pounds that are being paid out in litigation within maternity services, and that is 51% of all litigation costs that the NHS across all departments are paying out at the moment. Bearing in mind that they are just the families that are being paid money. That doesn't cover the thousands of families who have had substandard care, have not been listened to, but in a legal sense are not able to present a case that will be rewarded as such. That's an awful way of putting it, but you know, like the compensation that they should get. Because generally what gets paid out within a court of law is where there is clear physical harm that has been done. And I think that's one of the things that I find quite sad within our maternity services, is that is prioritised so much above psychological harm. Because that's obviously really important too. As you've described with your traumatic experience, yes, there was physical harm there, but you then had years of psychological trauma to then deal with and unpack. And it is one of the problems, I think, within maternity services that we have at the moment, because of this high litigation culture. It is part of what the drivers for the high intervention rates that we're getting. And I've definitely had conversations with midwives before around we need to prove that we have done something, and that's almost irrespective of whether that something is what is best for that mum and baby,
or reasonable, proportionate, or necessary.
Exactly, just so they feel that if they were in that position of having to defend the care that they gave in a court of law, they'd be able to stand there and say, but I did something. And I find that really sad. And the other thing that she highlights within the report is that cost is almost the same as the cost to deliver NHS maternity services at the moment. Which is just shocking, is it? Like, it's hard to wrap your head around those figures. And I've always said, because again, one of the things that comes out in the report and has come out in many reports before is safe staffing. We know that hospitals are overstretched. You can't possibly deliver high level care if you don't have the staff to be able to do that. And it's been years now that it has been underfunded and way overstretched. But I always think if they got a good cash injection, had good staffing, but that will have to be done up front, how much will we then be able to bring those litigation costs down? You know, because families are then receiving the appropriate high level care that they should be getting. But yeah, that's what jumped out at me.
I mean, so many questions again from what you've just shared. 51%.
Yeah.
Just 51%.
Yeah, of all NHS litigation payouts.
So that basically is over half of births are ending in...
So not over half of births, but over half of what the NHS is paying out across all departments.
All departments.
So maternity is 50%. If you then, the rest of the 49% is going to be orthopaedics, surgery.
We have a dog dreaming now. He's dreaming about the report.
Yeah, horrified.
Horrified. So the 51% across maternity services.
51% across all of the NHS.
All of the NHS?
Yeah.
Maternity services.
Maternity services makes 51% of the litigation payouts. So if you take a hospital and look at all the different departments that you've got there, you've got geriatric, you've got urology, you've got gynecology, you've got orthopedics and everything else. Maternity is one small department within a trust. But the litigation, when you look at the whole hospital, 51% of that is going towards maternity. It's so vastly outstretching every other department, even when you put it all together, which is just shocking.
And that's compensation.
Yeah.
For negligence.
Yeah. Yeah, it is.
Be it to the mother.
Or the baby.
The baby.
Yeah.
I mean, that's...
It's a lot, isn't it? It's really hard to wrap your head around that.
And that's without the families that don't come forward.
Yeah.
I was told when I'd finally been able to share the trauma verbally with that independent midwife that I could have gone for compensation myself for the PTSD and the trauma it had caused, and how it had affected my life, having to take time out of university and my degree, how to this day I'm not the best with blood. I've got much better through different healing practices. Yeah. But there's so many people that won't come forward either. Yeah.
Because to go through that process is re-traumatizing. You know, to stand there and say, this was my experience, this was my journey, and because it's in a court of law, you know that that's also going to get picked apart by the NHS defence lawyers. That takes a lot, doesn't it, to sit there and share something that's so vulnerable, but also have somebody pick it apart, you know, try to poke holes in it so they don't have to pay out.
And no amount of money, let's face it, can put a price on your safety. Yeah. Or your child's safety. Or yours and your child's life.
Yeah, completely agree.
So yes, you might get an extremely large payout for some birth trauma, but it still doesn't take the trauma away.
No,
it's not going to take the scar away or the PTSD away or, you know. Wow. Yeah,
it's a lot.
It is.
And that's without going into the other stats within there, like disproportionately people from lower socioeconomic backgrounds are disproportionately higher, like more likely to experience poor care. If you are of a global majority, you're more likely to have inappropriate care. And again, time and again, these things come out. And one of the things that I found really sad within the report is that Donna Ockenden highlighted that they had to go in search of families from global majority backgrounds because they were so much less likely to come forward with their own stories. And that just speaks to the level of how much they're not listened to. They're so used to people not listening and taking their experiences seriously that even when there's such a massive investigation going on, there's a level of distrust. Will anybody listen to me, and will it make any difference? And I just find that horrendous. Like, what does that say about maternity services? Yeah, I find that so sad.
And I get that. I get the trust. You know, I didn't trust the NHS anymore. Yeah. I didn't trust that I could give birth safely in hospital and that I could be listened to. Yeah. And I was petrified. Yeah. You could not have paid me 100 billion trillion to give birth in that hospital.
I get that.
With my fourth child. Yeah. And I was like, I'm doing it at home, and that's that. Yeah.
And one of the things that actually really annoys me, I'm just going to find it within the report.
Absolutely.
So she's got lots of recommendations, But before she talks about the recommendations, she highlights the challenges that we are facing within maternity services. So she highlights that unfortunately maternal mortality rates have gone up within the UK, which as a developed country should just not be happening. Again, about the if you are from a global majority, the inequalities, and if you're from a poorer background, that you're less likely to experience good care, which just fundamentally blows my mind. 100%. But then she goes on to say that the landscape of maternity services is, we must be aware that the maternal population is more complex, that there are more obese women, that there are more women with physical and mental health conditions, and women who die are more likely to have pre-existing conditions. And the thing that really gets me angry about that is, to me, that's throwing it back on women.
Deflection.
Yeah, it's saying, because you're more complex,
you're more likely to die.
Yeah, and it's your fault almost.
Yeah, it sounds like an excuse.
Yeah, exactly. And the reason why I take umbrage with it so much is, if you talk to any independent midwife and ask them about their outcomes, and you compare it to the nearest local NHS trust, our outcomes are always better. I have very complex clients with very complex needs.
Yeah.
You know, as you've just said yourself, you were told you're high risk and you shouldn't be having a home birth.
Yeah.
But you had a safe home birth within my care and with the midwife who cared for you for Tobias's birth.
Absolutely.
It is possible.
Of course it is. And I had a completely natural third stage.
Yes, exactly.
I did not have the injection of syntrametrin. Is that how you
Syntrametrin. Yeah.
For the placenta to be helped along post-birth.
Yeah.
I had a physiological third stage.
Yeah.
And that's after doing my own research.
Yeah.
And reading around and discussing with you that I didn't want to have intervention and have that injection.
Yeah.
If your oxytocin is high, if you feel safe and secure and you trust the person you're birthing with and your surroundings, and how efficiently and safely did I deliver that placenta.
Absolutely.
But, you know, we even did delayed cord clamping with Freya. We left the placenta out, attached, wait for white.
Yeah.
Tell NHS, fifth baby, oh, you're at such a high risk of a PPH, because I've already had a PPH.
Yeah.
With Elliot, the third. They're like, no, you can't have a physiological third stage. This is dangerous, and they implement all that fear. But when you do the research on our natural hormones, your environment, you are so much safer when you're in your own home.
Yeah. And we also had a conversation around, if you did have a heavier bleed, how that would be managed, didn't we?
Yes, we did, absolutely.
And that is something that I don't shy away from having those conversations with my clients. I think it's really important to go into birth eyes wide open. I always talk about the different emergency situations that may occur, highlighting that it's really rare that they happen, but also how we would manage those.
Yeah.
And that is a part of having informed consent, right?
Mm-hmm.
You need to have all the information, the full picture, to then be able to make the decision that is right for you with all that information. And what I go into universities from time to time now and talk to student midwives, and they all freak out about the fact that I have a lot of clients that would be termed out of guidance. They're opting for things that
Maya naughty out of guidance.
Yes, naughty. But their fear is, but what if something goes wrong and that's going to fall back on me? And my response to that is always, but have you given that woman all the information that you need to, then you've done your job.
It's about the woman making an informed decision for her.
Exactly.
And if you trust yourself, your knowledge, your practice, your wisdom, that should be enough also for you to evidence that you've done a safe risk assessment, that you have given informed decision and all the information. I remember learning some of the ingredients in just some of the interventional drugs they give you in hospital, and had I known the ingredients in some of those things, I would have declined. I did not know the ingredients. I was just like, oh my goodness. There were so many times I was not informed and I consented.
So then it's not informed consent.
No, it's not.
I recently had a client who we ended up transferring into hospital because that is a part of safe care. There will be times,
where it needs to happen.
Exactly. As an independent midwife, I cannot guarantee that you are going to get the exact birth that you want. I want to be able to do that, but I can't. I'm not God. And sometimes things go on their own journey. I always say birth is its own beast.
Oh, I like that. Birth is its own beast.
And, we can absolutely influence it. Things like being really informed beforehand and making sure that situations are where your oxytocin is going to be high, having the right people around you, all those kinds of things. But fundamentally, birth will transpire however it will. And if you do need to go into hospital, then we will have that conversation. I will never force a woman, but we will talk through my reasoning behind it. So the client that I had recently, we did end up going in, and the first consultant that we saw was quite honestly awful. And she called him out on it. And she said, you're not giving me informed choice. And he ran out of that room.
Did he?
Pretty much, yeah.
Fantastic.
Yeah.
What a beast. That birth was a beast. Chased him out.
And she, bless her, she was like, well...
How brave in labour as well.
100%.
What brave woman.
Yeah. She said, I'm going to have to say yes because you're not giving me any choice, but it's not informed choice that you're giving me. So, and he was like, well, right, you need to have a second opinion. And then the second doctor that came, after a long wait, was so much better. Really listened, took into consideration her thoughts, her wishes, and explained himself better.
Yeah.
So, yeah.
That's amazing.
Yeah. Yeah.
Again, something positive that came out of a situation that had to change.
Exactly.
But because you will have put in a plan, you'll have had that discussion.
Yeah.
She had time to prepare.
Yeah.
And it was probably a lot calmer transition.
Yeah. Yeah.
And that comes with the continuity.
Yeah.
It comes with the getting to know.
Yes.
Understanding each other and trusting each other.
Yeah.
Which is one of the most powerful things about independent care.
Yeah. Yeah, I'd agree.
I have said for years, I would rather pay for my daughter or sons, if they choose to have children, I'd rather pay for their independent midwifery package than their wedding package.
I get that entirely.
Instead of paying 7 to 50 grand for some palatial wedding and for hundreds of people to waste food because you're all too drunk.
Yeah.
And yes, a wedding day is amazing, but you cannot put a price on your grandchildren or your children's life.
Yeah.
Their safety and their experience in birth, because that can shape them as a parent for years.
Absolutely does. It's so fundamental. Yeah.
So no wedding packages from me, kids. If you want my grandbabies, I'll pay for the independent care. Hopefully they don't make me a grandma too soon. I'm only 37. I'm like, just wait a bit longer. I've always said, live your life. Don't be a teenage mum like I was. I'm breaking that cycle with my babies. I'd still support them, if they ended up being young parents, of course. But wow. Okay. My next question. Are you ready?
Yeah.
Have you still got capacity to answer the questions? how does your care differ as an independent midwife? Because there's loads of independent midwives out there, and people need to do their research if they're contemplating this, but how's your care different?
So I obviously think that all independent midwives are fabulous. I would say each of us will probably focus on different things and highlight different areas. So the things that are really important to me is being trauma informed, because so many women and families do carry trauma, and it's not always birth trauma. You know, it can be other situations, things that have happened in their life that is now impacting, especially if you've experienced abuse or anything like that throughout your life. So that is really fundamentally important to me. I'm also a Christian midwife. I'm really open about that. And I'm open about it because creating spiritual safety is really important to me. To me, it doesn't matter if your beliefs are the same as mine. Obviously, we have differing beliefs. But to know that you can come as you are in your entirety, you don't have to park a part of you because you're worried that might make somebody uncomfortable, is really, really important. Because I did have NHS births, and because of my experiences as a midwife, I ended up putting in almost disclaimers within my birth plan around my Christian faith, because I didn't know the midwife that was going to attend in my labour, and I was really worried about how they might respond to some of the things that were and are important to me, you know, like worship music and praying. So that was important for me. But I've also cared for yourself who has pagan beliefs. I've cared for women that are Muslim, and many families that have no spiritual beliefs, either agnostic or atheist. So you don't have to be a Christian
to work with you.
Yeah, absolutely. But I know that for some families that are Christian, to know that their midwife is also a Christian could be really safe. It creates a safe space. So yeah, they're the main things. I'm also clearly really passionate about home birth. That is predominantly the clients that I care for. I think it is fair to say that as soon as you step into a hospital, even if you've got an independent midwife or a doula with you, there is only so much influence we can have in there. We absolutely will support and advocate for you, but we cannot make people behave in a certain way. We cannot take away the system
and the red tape.
Yeah, exactly. So we absolutely can support you, and I have supported women within hospital births, absolutely. But it is different to being at home. But quite a lot of people see home birth and go, oh, it's not safe, without having any understanding of what it involves. You know, things like, I carry emergency drugs with me, I carry emergency equipment if a baby needs support with breathing. It's not a hippie convention, as much as we might love a good hippie
Well, it's
convention.
not a free birth. I mean, that's another podcast, isn't it, to discuss free birthing.
Yeah.
There were so many things you just said in that response that I just love. And I still can't stop thinking about Birth is a Beast. Birth is a Beast, that has to be the title, I think.
Yeah, there
Birth
you
is
go.
a Beast. You've birthed the title. I can honestly say, from working with you, I didn't even realise you were a Christian midwife for quite a few months. There was no indoctrination. There was no pressure. You come from such beautiful, neutral, grounding space. And you know, I was raised partly Christian by my birth mother. I do actually have a tattoo of a cross on my foot. I'm sure you've noticed that over the years. That's because I used to hate my feet and my bunions before I had surgery, so I just got a random tattoo of an anklet. How classy. Yeah. But my mother did actually teach me the Lord's Prayer growing up. And I still, every now and again, I do pray. I don't believe there is a God, you know, and the Christian Bible as such, but I believe there is something. There is a higher being. There is my guides, my ancestors, angels that I work with, you know. And we do follow the pagan, you know, traditions and calendars and lunar cycle. But there was never any undertone of anything working with you, which is so lovely and so authentic about you. But it was also beautiful to learn more about you and your practices and your personal beliefs, because that also builds, like we say, all that relationship all the time. And what you've shared in relation to going and transferring into hospital and working with women that choose to have a hospital birth, we did actually have quite a lot of hospital appointments with Freya, didn't we?
Yeah, we did.
Because I'd had 13 centimetres of my cervix removed prior with LETS treatment and cervical cells, there was quite a lot of anxiety for me personally around holding the pregnancy, and would a stitch be something in the cervix we'd have to consider? Which again, any form of intervention, risk, there was so much to unpack there. And there was also my mental well-being. I've been through a colourful life. There was a lot of trauma that I'd been through in the past, even sexual trauma and domestic violence prior to my husband now. And a lot of that was coming to the surface, and anxieties for things for me to, you know, work through. And it was really important that my mental health was managed carefully. So, you know, the fact that we did go to those hospital appointments and you were there by my side, pretty much, I think there was only maybe one that you couldn't attend, but Martin was there anyway. But to have you there for scans, you know, for the diabetes test I ended up having, you know, for that consultant to sit there and to discuss things. And she was actually
really good,
pretty forthcoming and welcoming of my practices and our envision of this home birth in the garden, as long as we got a heater, because it'd be March. But it felt so empowering to have you sat with me, and made me feel like I could advocate for myself more, even though I might come across as quite confident and assertive and whatever. You know my vulnerable side, you've seen them. And we do need that support when we're carrying life.
Yeah, we do. It's to go to hospital, even whether it's for birth or a appointment, you are entering an alien environment. There are power dynamics at play. We can't ignore that. So I absolutely get that. Even as a midwife, being pregnant and very used to hospital environments, I found myself agreeing to stuff during my pregnancies, and then I'd come home and be like, that's not what I want, and then I'd ring up and go, actually, it's hard.
It's the language that can be used. There's so much coercion in there, isn't there?
Unfortunately.
So a big question people might want to know. I know it, but others will be thinking, all right, how much is this care? This is private care, is independent midwifery. I was blessed enough to have my first midwifery, independent midwife, commissioned through the NHS, because there used to be something called one-to-one midwives. And I literally was one of the last people funded by a miracle to get that care funded. But it got scrapped literally just after Tobias was born, which is really sad, because women could just go to the doctors and fill out a few forms if they knew about them, because I didn't know about them and I'd had 3 babies. And then you would hand it in, and then you'd be appointed a one-to-one midwife. and that's it. Your appointments would start at home. So if somebody is seriously contemplating this, wanting to look at a birth package, how much is it?
So it is from the beginning to through pregnancy all the way, labour, and then for a month's worth of postnatal care afterwards, it is £9,500.
Yeah.
And I have a second package that starts at 30 weeks of pregnancy, all the way through until with 2 weeks postnatal care, and that is £8,000.
Okay.
And I know that some people go when they hear that, but if you compare it to many other things, we're talking about private healthcare here for maternity services, especially considering the general landscape, the insurance cost that I have to cover me, which is a legal requirement, understandably, a regulatory requirement. It is high.
Yeah.
So that is a big part of it. I also find it really interesting when people are like, oh, you're going to pay for that, but how about, like you've already mentioned, big fancy weddings,
holidays?
Exactly. Many people spend that on holidays,
designer clothes,
exactly,
all the things you buy for the baby. But from having 5, I've learned they need cuddles, yes, they're bottom changing, and milk, but they really don't need all these fancy swings and thousands of pounds worth of prams. The best thing I ever bought was a sling, so I could get shit done with a baby.
Absolutely. I'm right there with you.
Vintage for all the baby clothes because they grow that fast.
And if you had like a relative who needed a hip or a knee operation, it's a similar kind of price, and I feel like there's less flack that comes with that than saying that you're going to go private for maternity care, which is really interesting.
It is. It's like you can't put a price on. It is literally one sperm, one egg, one miracle. Yeah. To have a child, we're so blessed. Yeah. If we get to be a parent, it's the most priceless thing, and why not make it the most beautiful experience that you're ever going to go through? Yeah. By having that continuity of care, that bond, that relationship, the appointments in your own home. Yeah. Tobias doing a Doppler on my tummy and hearing Freya's heartbeat for the first time. Yeah. You know, all the kids had a go doing the Doppler, and there were so many moments, you know, them watching you dipstick my wee, Tobias doing my blood pressure. Yeah. Like, if you've got other children as well, getting them involved in the pregnancy and the preparation for a sibling, it's fantastic. Yeah. Yeah. I love it. Can't put a price on that. No. And do you offer direct debits? Payment plans?
So, yes, I offer payment plans. Most of my clients do pay via a payment plan. So,
we did, yeah. We paid. Obviously, Freya was the paid package, and you know, we did payment plan, and it was a lot. But you saw, we literally made sure we had that money available. Yeah. We found a way. We sold things. We did all sorts to make sure we had the money available. Yeah. It's priceless.
Yeah. I obviously am biased. I think it's absolutely worth it, and I know if I had any more, I absolutely would be having independent care.
Yeah, and I'm sure the prices will just range varied, you know, between independence and between wherever you are in the country and all that kind of thing. But it's really nice to get an idea so people you can also plan this. Like, if you're somebody that likes to plan ahead. Yeah. And you're thinking, oh, we're getting married next year and we're going to start trying for children in a couple of years' time. Yeah. You could even set up an ISA or some sort of fund. Or you could say to family, instead of buying us kettles and toasters and crockery sets for our wedding, like a honeymoon fund. Yeah. People often do for weddings.
Yeah, of course.
Can you support us with our birth package? We're going to be trying for a baby in the years to come, and we'd like to go for private care because it's the safest thing and it's the decision that's right for us.
Yeah, absolutely. Yeah. And I have absolutely had clients who family has helped out. And I think especially for families where there has been trauma before, I think quite often family is willing to help and support within that. I wish that every woman could have this level of care.
They deserve it.
Absolutely do. I do have a much smaller caseload now. I used to have 2 a month. I have chosen to go down to 1 a month. My son is starting school and I want to be more available for him. And that just feels right. So that again is also part of the cost, to be able to guarantee, you know, the midwife that you've hired to be present at your birth, because we can only take on so many.
We can, and that's so authentic that you're admitting your capacity for care.
Yeah.
And so many don't do that. They're not willing to hold their hands up and say, I haven't got space for this.
Yeah.
I've seen it in other sectors.
Yeah.
You know, where they'd rather take the money and not be able to be fully present or supportive or that's another podcast. You've been amazing.
Oh, I love chatting to you, Fran.
You have been fantastic. I've even learned so much more today. And I'm sure those that choose to tune in and watch this will have learned so much. Hopefully they've laughed. Hopefully they've learned something, felt some, you know, resonance and relatability to this discussion. I'd love to do you a manifestation card.
Yeah.
Would you be happy to do one of those?
Yeah.
And I've got your gift.
Fran.
You're just going to laugh. So, I'm just going to sage your cards.
Okay.
Would you like to share what it is?
It says focus equals manifesting, and focus with emotion equals powerful manifesting. Interesting.
I like that. So what we focus on, we manifest.
Yeah. That's good.
Yeah. Thoughts become things.
Yes, it's very true. It's
and
very
you're,
true.
I guess, focusing on just bringing women the care they deserve.
Yeah.
And if you focus on that, you will continue to do that throughout your work.
Yeah.
You know?
Yeah. Good.
Now, this is your gift. It's just going to make you laugh.
I've spied what it says on
Have you
top.
spied? You're cheeky.
What?
But it's your favourite colour.
It is. It is. I love it. Thank you.
I just hope your children don't repeat it.
I mean, they can't read just yet, so we're safe for another year at least. Probably true as well.
Yeah.
It says waffle wanker.
It's actually what I call myself because,
Yeah.
as you know, I love to talk.
We could chat for hours.
We could chat for hours. This could have gone on for like 10 hours, this podcast. But yes, thank you for coming on and being a waffle wanker with me.
Love it.
You only get a mug if you come on, and they're all coming out in different colours and things. But you love purple, and I was like, it was very much in the theme. And it's Freya's. She looks amazing in purple. It's one of my favourite colours. So thank you so much.
Thank you. It's been a pleasure.
It has. Oh, thank you, darling.
Anytime.
And keep doing what you're doing.
Thank you. And you.
Thank you.
And you mentioned about maybe being a doula.
I have.
You
Yes.
would be an amazing doula. You really would. Yeah, you know how to hold space. Yeah.
That means a lot.
Yeah.
I feel like it's there.
Yeah.
When I get empty nest syndrome when Freya gets older, because we're not having any more.
Yeah.
She's the last one,
Yeah.
as you know. But with everything I've been through,
Yeah.
all my birth experience, my wisdom.
Yeah, absolutely.
I did nearly do a degree in midwifery once, but I changed courses to creative writing instead, and it's there, all the breastfeeding support I've done over the years in the group, and I think I've got the capacity in the future to be a doula, and absolutely. I can see myself drumming for birth.
Yes, yeah. I was at a birth last year where the doula did a sound bath.
Oh wow. Yeah.
And I could feel it. I could really feel like that resonance. I was like, oh, I can see how that could really help you to just like focus and
interlinked with hypnobirthing, guided meditations, which I already write, and the network of women I have in my life. I just feel like I could really offer beautiful space and cook the meals and do the cleaning and everything that I needed post birth. So yeah, that's exciting, and that's to come.
Let me know when you do it.
But until next time, thank you for tuning in, and remember, always be kind and have courage.